Hello and welcome to Freedom Watch, your daily dose of raw liberty online at foxnews.com. I'm Judge Andrew Napolitano here, defending freedom, defending your natural rights, and defending your right to have a government that stays within the confines of the Constitution. In an effort to keep members of the House of Representatives from actually voting to adopt the Senate version of the health care reforms, the Democratic leadership is contemplating having members vote on a procedural resolution that retroactively deems the House to have enacted the Senate version at some time in the past. This sets up a conflict between two parts of the Constitution. One part requires that whatever makes its way to the president must first have been voted on and passed by each House of Congress. And another part permits each House of Congress to write its own rules. The Supreme Court has been reluctant to interfere with the inner workings of Congress, as Congress has been reluctant to interfere with the inner workings of the court. The remedy here, if the House does this, is to vote the bums out of office. Joining me now to discuss what the bums in office might do to us with health care is Michael Cannon, Cato Institute's Director of Health Policy Studies. Michael, welcome back to Freedom Watch.
Thanks for having me.
Well, let's say that this thing does pass, whether by hook or by crook, or whether by majority vote or after a legitimate debate, whatever. Let's say that it becomes law. The government will begin taxing us this year. It won't be providing significant benefits until 2014. What effect would you expect on the health care delivery system in America, if any, before this kicks in the interregnum between now and 2014?
Well, I think that what we're going to see is a lot of people are going to have to pay more for their health insurance because of the new taxes in this legislation. There are a lot of taxes on the sick. But I don't think that we have to look to the CBO cost estimates or look to what anyone is predicting about what would happen under the Obama health plan. All we have to do is look to Massachusetts. Massachusetts enacted the Obama plan in 2006. It's been in effect for a few years now. And we can see exactly what this plan does to a health insurance market. They've been able to cover a small number of additional previously uninsured residents, but they haven't achieved universal coverage.
Right.
But worse, they have been unable to control healthcare costs. In fact, healthcare costs have exploded to the point where the state treasurer yesterday came out and said that this is bankrupting the Commonwealth of Massachusetts, and it will bankrupt the nation if we enact it at the federal level.
And according to the Wall Street Journal this morning, I think we both read from the same page, 60% of primary care physicians, that's the doctor you go to when you have a cold or a flu or something pretty basic, somebody we didn't used to call a specialist. 60% of primary care physicians are not taking on new patients. They're loyal to the patients they already have, but they are reluctant to take on new patients because they know it's going to cost them more than they're going to be compensated for. Question, is this same type of thing likely to happen in 2014 or whenever the Senate health care version of the law kicks in?
Absolutely. You know, the Obama plan to a large extent just offers a paper guarantee of health coverage, but that doesn't mean that people will get access to medical care. About half of the estimated 30 million people who would be covered under the Obama plan would get coverage through the Medicaid program. Now, if you look at the Obama administration's chief actuary and what he has said about this legislation, he says that you can throw another 15 million people into the Medicaid program, but that program pays doctors so little and so many doctors don't participate in the Medicaid program that you won't actually be giving those people access to medical care. So it will be a hollow victory in that you'll maybe be crowding out private health insurance and giving people government health insurance where they can't actually get in to see a doctor. There's been some of that in Massachusetts as well. The Massachusetts health plan, under that, the government programs have crowded out private insurance. And even in the private sector, people are having a difficult time accessing care. And it's only going to get worse under the cost control mechanisms that Massachusetts has proposed and that President Obama looks ready to adopt, which would use price controls to encourage insurance companies to ration care and deny access to care to people. This is where the Obama plan is headed.
We are chatting with Michael Cannon, who's the director of Cato Institute's Health Policy Studies. I sort of chuckled the other day, Michael, when somebody in one of the Democratic caucuses, we ran this on Fox, and I'm not sure who said it, and I don't know if it was proposed seriously or tongue-in-cheek, suggested, well, we should just offer legislation that makes waiting lines in emergency rooms illegal. I mean, the government really thinks that it can offer legislation to stop the rain or to stop hurricanes or to extend the day from 24 hours to 26. I mean, just as an example of them wanting to violate 2 + 2 = 4. If they force insurance carriers to take people with pre-existing injuries, and if they cap the premiums that those insurance carriers can charge, and if they let people buy the insurance after the onset of the injuries, they will put those carriers out of business. Economics 101.
It's like the Danish king who said that he decreed that he would roll back the seas. You know, we used to think that that was a joke until President Obama said that he could roll back the seas. And the Congress can pass as many laws as it wants, but it cannot repeal the laws of economics. So when you set prices below what the market will bear, what you end up getting is long lines. You get queues and you get rationing by waiting. We've seen it in this country when it comes to gasoline. We've seen it in this country when it comes to health care. Look at Medicaid. Look at the waiting list for organ transplants. There are people dying because of the price controls that the government imposes on organs.
Go to any Veterans Administration hospital and you'll see the lines almost coming out the door. That's the future of medical delivery in this country, in my view, if this stuff becomes law.
And the only way that government can avoid those sorts of long waits is to just throw so much, an obscene amount of money at the program so that there's an obscene amount of waste. And that's actually the Medicare program. Here in the United States, we get the worst of both worlds. We get a government-run program, Medicaid, that pays too little and provides paltry access to care and leaves patients with worse health outcomes. We also get the Medicare program that pays doctors too much and ends up wasting a lot of money and, in fact, even harming patients because it provides them such ready access to care that is often harmful.
Michael Cannon from Cato's Health Institute, thanks very much for joining us.
Thanks for having me.